Time for the KBOI Medical Moment, brought to you by Regents Blue Shield of Idaho, featuring Dr. Kenny Bramwell, the Executive Medical Director for Regents. Dr. Bramwell, good morning.
Morning, Chris. Morning, Paul J.
Morning, Doc. It sure seems like it's been quite a while now since we've heard anything encouraging on the Alzheimer's front. That's changed, though, in the last few days. What's the news?
Yeah, this is great news. There's a pair of drug companies who released the Phase 2 results of their ongoing studies at last week's Alzheimer's Association International Conference in Chicago. At a high level, these companies reported that they have a medication that appears to clear the toxic amyloid proteins from the brain and significantly slow the rate of a patient's mental decline.
Okay, it almost sounds like the new drug is sort of like, Drano for the brain, clearing out bad proteins. Is that a fair comparison?
No, that's quite fair. Beta amyloid, which is the protein in question, exists in all of our brains. Normally, it gets cleared away naturally, but in Alzheimer's patients, the body's normal processes for getting rid of these beta amyloid proteins goes awry. This new medication, which is technically called a monoclonal antibody, appears to be particularly good at sopping up these toxic beta amyloid fragments that cause these problems for these patients.
So what's next?
Well, like all promising medical research, they need to do more testing, we need to get more data, and we need some more time. But it's very encouraging.
Dr. Bramwell, moving now from head to toe, I guess you have a timely reminder for people heading to the pool, the water park, or even the locker room showers, and what would that be?
Yeah, well, with the heat advisory we were just talking about, in a nutshell, if you want to fight foot fungus, you fasten on a pair of flip-flops. Athlete's foot fungus thrives in places that are warm and damp, which exists in a lot of places that all of us are going to this time of year when it's so hot. Places like public showers at swimming pools and locker rooms after a two-a-day football practice.
Who knew flip-flops could be comfortable and highly functional fungus fighters, right?
Yeah. Well, both the CDC and our country's podiatrists are promoting these. They strongly recommend flip-flops or sandals or shower shoes in warm, moist public places. Additionally, they advise cleaning these water sandals after each use, washing our feet with soap and wiping them dry with a towel, avoiding socks made of material that don't dry easily, such as nylon, and then drying things in the sun, which seems to have a fungicidal effect. So protected feet are happy feet.
And happy feet are good to have. Dr. Bramwell, we appreciate your time on KBOI this morning.
Thanks, guys. Stay out of the sun.
Yes. Thanks, Doc.
It's the KBOI Medical Moment, brought to you every Tuesday by Regents, featuring Dr. Kenny Bramwell, the Regents Blue Shield of Idaho Director.
Better life.